Medical professionals have read it. Have you ever had a patient so lacking in common sense you wondered how they made it this far? If so, what is your story? Had a buddy who was an EMT. He was called out to a location for a gunshot wound. Apparently what happened is the father was mowing his lawn when he accidentally touched part of the mower near the engine and burned his hand. He got mad at the lawnmower, pulled out his pistol, and shot it. The bullet ricocheted and hit his son in the leg. Not me, but my mother would pick up shifts as a nurse sometimes in labor and delivery, and she had met a handful of women who didn't know the baby was going to be coming out of their vaginas. Like no clue. My mom usually said something like, "How you got it in is how it's coming out, honey." This was the late 90s to early 2000s. Rural Eck here. 35-year-old female walks in with right-sided jaw/neck swelling. I think it happened because I ate some meat yesterday that my body is reacting to 10 minutes later. Oh yeah, and I accidentally swallowed a bee and it stung me in my mouth right before this happened. Sorry, I forgot to mention that. Had an 18 or a 19-year-old girl come in my ear with some complaint that required an X-ray. It's standard that we do a urine pregnancy test prior to imaging on any female of childbearing years. She insisted she'd never had sex and there was zero possibility of pregnancy. We did the test anyway and it resulted that she was pregnant. We did a blood pregnancy test to confirm the result, since she insisted she couldn't possibly be pregnant because she'd never had sex. That was positive too. We gave her a few minutes to herself to figure out what the hell happened, and when I returned to check on her short time later she asked me if she could get pregnant even though her boyfriend didn't go all the way, and she 100% believed that long as his penis wasn't entirely in her it didn't count as sex. It took nearly a half hour of explaining reproduction to her for her to understand that whether it's halfway in or all the way in, sperm travel. Not a personal experience, but one from a colleague of mine. I only saw the pics. So the 60-something-year-old suffers from an acute complication and gets a pacemaker to solve the problem. Everything goes normally and as planned. He recovers. Every care meds that he needs to take are prescribed, explained, and medical appointments with a cardiologist/arrhythmologist are scheduled so that he may get the follow-up he needs. The man then proceeds to never show up to any appointment and never answers when he calls from the hospital to know of him and reschedule. This went on for around 3 years. Until he shows up without formal warning and asks to talk with the doctor that did the procedure to put his pacemaker. People are weirded out, but seeing that on the day the doctor was present and this patient was in clear distress, they talk to him and manage a couple of minutes to have the doctor check on him. Inside the appointment room, the doctor takes notice that this man is wearing a bra inside his shirt. The man explains he has been wearing his daughter's bra for 3 months after his problem got worse. The shirt is asked to be taken off and there he stands, the shirtless man wearing his daughter's bra, showing off the pacemaker that should have been kept inside his body, dangling outside of it, being held by the left bra cup, with a big infected open wound above it with the pacemaker left still inserted onto his veins and connected to his heart. Nobody has any ideas how the man let that situation come to be or how he didn't die of sepsis or any other health problem that may appear for that matter. TLDR, man gets a pacemaker. Doesn't show up to appointments. 3 years later comes to the hospital looking for help, wearing his daughter's bra for 3 months, to serve as the holder for the pacemaker that got out of his body from his infected open wound. Had an adult male patient who needed a Foley catheter. His mother was in the room, and they both lived together in the backwoods of TN. I informed them both of the order for a catheter, how it works, and why it was needed. His mother stated, "Well, he's still a virgin and I'm not sure I'm comfortable with his virginity being taken in a hospital." EMS here. Had a diabetic in his 32-40 who refused to take insulin since 2012, it was 2020 at the time. When I took his blood sugar it only reads as high, meaning it was over 700 for glucometer to not read it. Upon seeing this, he asked me if that was high and then went, "Is this cause of all the ice cream I ate?" Played Facebook Messenger video with his girlfriend the entire time. Met him later on the parking lot after he got discharged, and it took this man less than 50 paces from the door to rip off his bandage covering his forearm, play with the wound until it started bleeding all over the place again. Knocked on our ambulance door and asked for a band-aid to fix it. We had to walk him back into the urn, bandaged his entire arm with gauze so that, hopefully, by the time he got it off it would have clotted enough for him to not end up exsanguinating himself. My sister told me a story of a woman with chronic blisters and lesions on her lips. They couldn't figure out what it was for weeks. It would heal and come back. Heal and come back. Turns out she would jam out on like 3 bags of salt and vinegar chip a day for weeks at a time until the sores hurt too bad to continue, then she'd go to the doctor. Pharmacist here. I had a woman bring in a literal sandwich bag and separate which she kept all her meds in. She needed help seeing which meds she was low or out on and asking different questions on the medications. When she pointed to an epical stating it was a blood pressure medicine, I immediately became concerned as to why pet medicine was in her bag, also why she is mixing all her meds in a bag in the first place, only to find out that she had been throwing her pet's med inside her bag of medicine. So Lord knows what she's been giving her dog or taking herself. I immediately stressed how important it is to keep medicine in its original container to protect the medicine and herself and to know the directions of how to take it. I've seen her a few times since then and glad to see she has since taken my advice. But how any pharmacist or doctor hasn't advised her on this before is beyond me. My wife is an anesthesiologist. When training junior doctors, one of the things she has go reinforce over and over again is that you never leave drugs unattended in an unsecured area in a hospital, even for a moment, because some people see drugs and think, fine, and take them even if they don't know what they are. They just raided a trolley or picked up a syringe off a bedside table. And then, because the drugs used for anesthetics in hospitals are quite serious, those people quite likely end up dead of vegetables. And this has actually happened more than once in hospitals she has worked in. Pharmacist. Don't even know where I would begin for some of the ridiculous situations I have had. Up there, however, has to be whenever I had a lady swallow a full box of suppositories and came in to complain that the issue has not cleared up and the medication tasted bad and was hard to swallow. Do sometimes wonder how people put one foot in front of the other. Not a medical professional, but I used to volunteer at a free medical clinic to take vitals and histories. A woman came in with pneumonia and wanted to know why her normal treatment of drinking half a bottle of Listerine and smoking a pack of cigarettes a day wasn't working. I asked why she thought smoking was good treatment for a lung infection, and she said, Indians used to purify the ground by burning all the weeds away before planting, so I'm smoking to purify my lungs. I left that one to the doctor. Former vet tech. Had a woman scream at me and my vet for telling her it's the law to have your dog vaccinated against rabies. She said the rabies vaccine causes autism in dogs and makes puppies stupid. Side note, 3 weeks later her puppy died of parvo. She got another one immediately after and did not clean her home. 2 more died in the following months. Animal control in the city had to get involved.
Thank you for watching the video. Don't forget to like and subscribe to the channel so you don't miss out on more content.